We're here with Mr. Jimmy Russell of Harrisonburg, and Mr. Russell, if you could catch us up to speed with what your condition was and kind of what brought you into the clinic.
Since early 90s, well actually in the 80s, I had a laminectomy, spinal decompression, cervical, and then in the early 2000s I had a lumbar laminectomy. I have severe spinal stenosis. Had problems with my back for as long as I can remember. It's really limited my ability to do a lot of things that I want to do. I'm 62 years old, and I really want to try to enjoy my retirement years with my grandchildren, my family. But pretty much that's it, spinal stenosis.
Now, how many operations had you had?
I've had actually 4. I had a disc procedure on my neck. I had a disc procedure with a bone replaced through my front of my neck and the back of my neck. I had a lower laminectomy, and I had a upper laminectomy.
And what kind of conditions or what kind of symptoms were you having with your stenosis?
It was so bad at one time that I would fall. I would lose control sometimes of my legs, especially my left leg. Before I had my first operation, back in the 80s, I literally couldn't put a credit card in a ATM machine or a card machine. I would have difficulty actually getting it in the slot. But the thing that scared me the most was I'd be walking along and I'd just lose one of my legs.
Just random, yeah. What therapies or what procedures other than the surgery had you tried prior to coming to our office?
Well, other than the surgeries, I've been to all kinds of physical people working with me, different programs, trying to strengthen muscles and so forth. I pretty much hadn't found anybody that could do anything for me other than surgery. In fact, Dr. Jane at UVA has suggested an additional surgery just before I started to come see you guys. Basically the question was, your pain's not going to ever go away unless we do the surgery. Is surgery serious? Do you want pain? Surgery, pain, surgery. So I decided I was done with the operations.
What pain were you having at that time that he suggested that?
Neck pain, shoulder pain, right shoulder. I still have limited motion in my neck when I turn it one way or the other. There's a little grinding sound I was having in my spinal, the bones in my spine. I could hear it grinding against each other when I turned my head. I'd have pain shooting out of my arm, and I had trouble sleeping, but mostly neck and that. My legs problem is pretty much kind of stabilized where I don't trip or fall.
Now, we performed spinal decompression on you. What was different after that treatment for you?
I noticed a change with the very first treatment. It was I felt less pain. It didn't totally go away. I felt less pain in my neck and my shoulder. The grinding sound that I was hearing in my ears lessened, and I felt definite improvement. I mean, it wasn't gone the first time by any means, but I certainly noticed a difference.
Mm-hmm. So I guess the main thing then is what has changed since you've been under our care?
Primarily, I've returned to what I think a normal life should be for a person my age. I've gotten since I've gotten to regular decompressions, I've been able to walk. I work out. I've lost 55 pounds. I walk 3.5 miles every day. I even do some lower and upper body weightlifting. I got to go hunting last year with my son, which was a blessing, and shoot this animal in Idaho. That I don't think I could have ever done without the Shenandoah Clinic.
Well, Mr. Russell, we appreciate your time, and we appreciate the patience. Thank you very much.
Thank you very much.